Healthy cities are cities that are prosperous, livable and sustainable. But healthy cities don't just happen. They result from creative vision, strategic decision-making and thoughtful implementation that respects the health needs and challenges of all residents. They happen by design through intentional and thoughtful investment and provision of infrastructure, programs and services with health in mind. Well, to discuss the vision when it comes to developing a healthy city, I am joined now by the MMC for Health and Social Development, Nonceba Molwele. Welcome to Joburg Tomorrow.
Thank you very much for Joburg for accommodating me.
It's a big privilege for us to have you in the studio today because we're very much interested in getting to know the vision of your department to understand the critical factors when it comes to transforming the city and how that is linked to the objective of creating Johannesburg into a global city region.
Yes, I'm also very honored to be part of this discussion today, where I will be talking about our dynamic city and how we are creating a global city region.
Fantastic. What are the critical factors when it comes to transforming the city's health and social development?
Transforming the city's health and social development is not just about health transformation. It is about a socio-economic transformation. It is about a livable city, as you correctly said, and it is about the citizens that are living in the city. So the global city region means that people should be able to move across the Gauteng. Not only in the city of Johannesburg, but it should be easy for the citizens to move from Johannesburg to Ekurhuleni, from Ekurhuleni to Tshwane, to all the cities within Gauteng. So as a global city region, it means that we must have efficient transport mode. It means people should be able to enjoy where they live. Mm-hmm. It means the services should be where people live. The city of Johannesburg, through our mayor, speaks about corridors of freedom. So corridors of freedom is about knitting the city together so that what you can get in Sandton, you are able to get it in Alexandra, you are able to get that in Soweto. So people don't have to spend a lot of money to go for social amenities. They don't have to spend a lot of money to go to shopping, but they can just hip-hop around where they live, and they should save the money that they would have used in transport for other things, for other social needs. Mm. But also in terms of transport, we're saying that we want to have efficient public transport. That is why as a city we have introduced the Rea Vaya Bus Rapid Transit, where people can pay very less in using public transport. Mm. But also as a city, we are now demarcating lanes for cycling, because we say to people, people must have a choice. Mm-hmm. If you don't want to get into a car or into a bus, you are able to cycle to where you want to go. Mm-hmm. Also, you can even walk depending on the distance. So we are demarcating the lanes. So we are making this city a livable city, mm-hmm. and where people can enjoy living where they live, so that we avoid people living their townships perhaps to other areas like Rosebank and Sandton, mm-hmm. but people should enjoy living in their spaces.
Mm-hmm. I think that is a very practical vision, a very practical approach. And I can see the link when it comes to providing healthcare services to the outlying areas so that it becomes more accessible. If you can maybe just unbundle some of the policies that you have in place that could make healthcare more accessible to everyone, so we don't have to travel out to the main centers and spend a lot of money traveling out to the main centers to have accessible healthcare.
Yes, our policy speaks about quality healthcare for all. And quality healthcare for all means that whenever or wherever people live, there should be a health facility. So it means people should not be traveling more than 5-kilometer radius to access the health facility. So when the city does planning, when the city plans the development in the area, there has to be a site or a space for health facility. So in the areas, because you would remember that when we took over power, some of the areas were very much deprived in that they don't even have health facilities. So what the city is doing now, we have identified those areas and we are putting health facilities in those areas so that health care can be accessible to everybody for us to achieve this goal of quality health for all. But we don't only just build infrastructure, we build the state-of-the-art clinics because we want to be comparable to the private sector. We want people to have a choice whether you want to go to Garden City Clinic or you want to go to our public clinic, because all the facilities and all what you get at Garden City Clinic, you should be able to access at our public.
Of course. And when we look at the statistics and we look at the high unemployment rates, we're seeing more people without jobs, more people that are going to be dependent on efficient, accessible healthcare services. And when we think about public hospitals versus private care hospitals, you know, there's this perception out there, and to some degree it's correct, that public hospitals are always lagging behind. That's because of the challenges. You look at South Africa's history as well. It's a huge challenge to get more infrastructure. It takes a lot of investment. How are you addressing that to bring public sector hospitals or public health care to a place where the private sector will actually be competing with public sector health?
Our Minister of Health, Dr. Molwele, speaks of the National Health Insurance. So the National Health Insurance implementation has already started. We have pilot sites where we were piloting the National Health Insurance. That is going to assist the country and especially our city to bridge the gap between the private sector facilities and the public facilities. So that interrelation and interrelation is actually going to be realized. Well, it's a long term, but it has already started. That is why when we now build the health facilities as public sector, we make sure that it complies with the national core standards and it actually matches the private sector facilities. But not only that, the insurance itself will actually help our poor people to access the same health services and health care that a rich person would access.
I think that is so critical in an economy like ours as well, because if you have to look at private sector healthcare, it's very expensive, and in a way, by doing that, you'll be bringing down the costs when it comes to private sector health, because it becomes more competitive in nature.
Yes, indeed. Yes, indeed. So that is the purpose of the National Health Insurance. So that is why when the introduction of the National Health Insurance was going to happen, the minister had conversations and interaction and engagement with the private sector.
Okay. Now, I've looked at some of your policies that you have in place, and it was very encouraging to see that you have something called a healthy living lifestyle. Tell us a little bit more about that, because health really does start with the individual.
Indeed, certainly health starts with the individual. So our program of healthy lifestyle, it's one of the pillars of the broader picture of the city of food security. So when we talk about food security, we cannot live outside healthy living lifestyle, because our people should know what is nutritious food. I mean, as an individual, you have to look at your plate and say, what is contained in my plate? Do I have vegetables? Do I have all the colors that are required? So that is the education we are doing to our communities. But over and above the nutrition, we're also encouraging the communities to be fit, because fitness is good for your health. So people should exercise, people should walk, people should cycle. That is why we're demarcating the lanes. The lanes for cycling and for walking, so that our people can have the opportunity to walk. So it's about, yes, it's a choice, but we are saying to the citizens, let us partner. Your choice shouldn't be disadvantaging us as government, because we're spending a lot of money in the health facilities to assist people who are suffering from diseases of lifestyle. And then if communities are partnering with us in taking care of their lives, in living healthy, it means that the burden that we're having and in the health system
Sure.
will actually be eased.
And food security is very important because, again, coming back to the economic outlook, it's very bleak. A lot of people unemployed. Some of our poor people are practically starving as well. We've heard something interesting about you developing food gardens as well. How is that coming along?
It's coming along very well, and it gets a lot of support from the citizens of Johannesburg, because it is this vision of the city that speaks about agriculture and food security. Because after we have discovered that some of the people within the city of Johannesburg are food insecure, we then came up with this program, and we marketed, we advertised, we partnered with the citizens to implement this vision. So what we are currently doing, we are mobilizing the community to grow their own food, because the number of people in Johannesburg who were growing their own food were very, very less. It was about 1% of the citizens of Johannesburg.
So you're actually empowering people.
We're empowering people. We are working with the Joburg market. So our Joburg market, it is the biggest market in the continent. But what the Joburg market told us at the beginning of this program is that only few percentage of the food comes into the market from Gauteng, let alone Johannesburg. So most of the vegetables that they are receiving in the market are coming from outside Gauteng. And we said, no, we must introduce urban agriculture. So now we talk about urban agriculture, where we encourage our citizens, and we don't just encourage them, we also work with them to grow their own food, but not only for consumption, but also to be able to get into the market and be business people and sell this food with the assistance of our Joburg market. We have developed agri-resource centers in all our regions. They are in operation. We have the land, but we still need more land, because the more people are getting into the program, the more there's a demand. So we have now a high demand of people who are saying, I'm interested in farming, I want to do farming, including young people. We have a group of young people who have joined us, who see farming as a way of getting out of poverty. So which is not about agriculture only, but also other form of farming. So people are now engaging on that.
Well, it's very encouraging to see exactly what your department and what government is doing at a grassroots level to really understand how it's actually empowering the citizens of Johannesburg. Thank you so much for your time. It was a big pleasure and an honor to talk to you today.
Thank you so much for the opportunity, and also the information sharing with our citizens, because the opportunity like this is not just about us, but it's also about people, the recipients of our services, also accessing this kind of information.
Definitely. Thank you so much.
Thank you very much.